We are at the crossroads of good agriculture meets good healthcare, which meets great policy. We now must reintroduce medical cannabis to mainstream medicine, just like it used to be prior to 1937. So I would like to dedicate today to a wonderful boy, Sam Martin, who passed away in 2014, and his family and their story is the inspiration for what we're doing here today. So we now have a duty of care to help the Aussie patient, and that's what we're here to do. Thank you.
We know that the Sunshine Coast is probably the most entrepreneurial region in Australia. And here we have a site that gets opened today that does bring together the best of Australia. We know we are world leaders when it comes to healthcare, world leaders when it comes to medicines. And here we are also as world leaders when it comes to agriculture. And when you have agriculture and health come together with strong, robust government policy, we have new businesses emerge using the best intellectual property that the world has to offer.
It's a privilege to be here today because of two things. One is you are creating something new, which is about opportunity and health outcomes for patients, and you're helping, secondly, to contribute to the Australian economy and growth. Medicinal cannabis is something which this government has legalised, subject to the most rigorous conditions and arguably some of the most rigorous conditions in the world, which is why Europe looks to Australia as a preferred supplier. We not only legalised it, but we then made sure that there was a contingency reserve. It was one of the first decisions I made on coming into this office, available for patients as production was being developed. Beyond that, we then opened up the export market, and we did that so as to ensure that there was both priority for Australian patients, that's a prerequisite of the export market, but also the capacity for Australian firms to provide healthcare to the world. And this is about helping patients who might have epilepsy, who might be suffering from cancer, post-traumatic stress, or in the palliative phases of life. And so it's about ensuring that there is the best care available. It is a highly regulated sector, and we make no apologies for that. But most importantly, it's about ensuring that if the doctors determine that the medicine should be available, it can be available.
Although this is a bit of a James Bond industry, if you strip away the words medical cannabis and you say Schedule 8 prescription medicine, most of us know you go to your doctor, if you're the right patient, you get the right product, it's dispensed through a secure pharmacy. If your doctor needs more information, of course, please visit MEDIFARM and we're happy to assist. You ask when will our product be available? We have already completed 2 harvests, so 2 grow cycles of the 4 that 5 can go on in a year. Very important, if we are here to help the Aussie patient, that we have a continuity of supply. Every plant that we saw today will produce enough medicine for 2 Aussie patients for a year's supply. As mentioned before, we've done 2 harvests. We have a significant volume in the vault. What you see today is a turnkey solution. We are fully licensed to go from plant to patient with those medicines from this facility, and we plan to do that before the end of this year. Due to the TGA, the Therapeutic Goods Administration, which is Australians' quality control of medicine, we do not advertise our products. So price and efficacy is left up to the doctor, as it should be. We all at some point in time have been to a doctor, and it's their clinical judgment that counts. I guess what we always remember is the power is with the patient in this industry, because it's their health that counts most.
It takes a lot of courage to invest, to create and to bring it all together, but it looks as if what we're going to see is better outcomes for Australian patients in the most regulated and safe environment that we could possibly establish, and that's a tremendous outcome for the Sunshine Coast, for Queensland, for Australia, but above all else for patients. So I am delighted to officially declare open MEDIFARM's Queensland operations.